This is the thing that I really want people to get. If you don't get anything from this video, I think the most important thing is to understand how different it is. So like when I was moving in my head, I was like, it's pharmacy. I mean, how different can it be? You've done the PEBC exam, so you think in your mind, I kind of know the drugs, but it's so different. I'm so excited for today's discussion. It's a follow-on from the last discussion that I had with Adiola Ali. So this is a discussion about the comparisons between UK pharmacy and Canadian pharmacy from a perspective of two pharmacists that have actually done the move and have been here for quite a while now and are both practicing in the same province. So I have my friend and colleague Fahana with me today. Hi, Fahana. Thank you so much for joining me. Thank you so much for taking the time out to be a part of this and basically help to educate people who may want to move. So we're going to get right into it. So just tell us a little bit about, just very briefly, about you and what you do.
Okay, so I am also qualified in England with, like Aura. I actually am Canadian, born and bred. So I went over to England just for university. And then from university, I applied for jobs. I was like, let me just get on the register here. So I ended up getting into the STEP program over there. And then actually, when you do your pre-registration, one of the STEP hospitals, you kind of have like a little bit of an edge internally. So then I got into the STEP program from there. And I kind of just ended up staying. And then I ended up being there for 12 years in total. So I came back here to Canada, which I think we'll go into a little bit more detail later on in the interview. And now I am, since I've qualified, I was kind of looking for jobs along the lines of what I was doing in the UK. So I'm currently working in a new role, which is based on like a lot of usage of medicines rather than patient facing. So like how medicines are used and kind of what are the drivers of using certain medications in certain therapeutic areas.
So there's two things I wanted to pick on that you mentioned, and some people may not know. So you mentioned doing your PreReg. So for people who are not from the UK, PreReg is basically a training year, which is like a postgraduate training year that all pharmacists in the UK have to do. And it's mandatory, it's a year, it's paid, and you can choose to do it in hospital or community. I'm not sure if you can do it in industry. I don't know, but you do it for a year. And after that year, you take the General Pharmacy Council exam and you basically pass or fail. If you pass, then you become a qualified pharmacist. So that's PreReg. And the other thing you mentioned was STEP. So what is a STEP hospital? And if you don't mind sharing, which STEP hospital did you do your PreReg at and which one did you go on to work in as a pharmacist?
Yeah, so the STEP program is, I don't actually remember what it stands for anymore, but I think it's a training program basically for structured training, an education program, maybe something. But nonetheless, it was a really good program. So basically what it is, it includes 4 London hospitals. So a couple are the big like tertiary teaching hospital centers, as well as some district general hospitals. So I did my pre-registration at Queen Elizabeth Hospital in Woolwich, so borderline like Kent, London. I then was able to get into, so the benefit of STEP program is that because you have a collaboration of hospitals, you can, after the first year and a half of your diploma, so you're also doing the UCL diploma alongside it, you can move on and do rotations in other areas that you find interesting. So I did a rotation in ICU at another district general, which is the Princess Royal University Hospital. And then I did it was a combination. So they have advanced surgery and they have like a general surgery. So I did it in general surgery where it was half elective orthopedic and half like GI. So I did that at Guy's and St. Thomas's, which is part of the STEP program. And then my last rotation was in geriatrics at King's College Hospital. So I got to kind of move around, which was really nice. I experienced, I think, all the trusts that were kind of involved. So it was really good. And they just, the STEP program is there just to give you some structured training. So they have rotas on how long you're going to do each rotation for, so that you can get a good understanding and foundation. And I think that's the main thing to realize, that it's a foundation. You don't become like an expert in any area within 3 months or 6 months sometimes. So it was a really good foundation to see what you actually liked and wanted to explore more and maybe specialize in the future.
So why did you move? I mean, you've given us a little bit of a hint as to why you moved back to Canada, but was there anything else that kind of motivated you to want to leave England and come back to Canada?
Yeah, so I think for me, it was more organic than most people because I'm Canadian and because I grew up here. So I think there's two elements to my decision. One was I left home when I was 17, 18 years old. So I think I got to a point in England where I wondered, what if I had stayed in Canada? What if I had gone to university in Canada? Where would I have ended up? Like all the what ifs, like would my life be different? Would I be leading like a better quality of life? Would I be leading a more balanced life? Would my career have taken off in a different way if I was in Canada? So all those what if questions. The second element was my family. So my parents are here. My sister is actually in England. So she came a few years after me. And so she's in England. So I had family there. But I think I was just, I was getting older. My parents are getting older and I was missing them. So that was definitely another factor. Career was a big factor, family was a big factor, but my career factor wasn't focused on pharmacy. It was focused on generally within healthcare, would I go a different direction? Would I excel in a different way? And I wanted to just explore that.
You did also, mention obviously going to university in England. Was there anything that inspired that, or was there any particular reason why you chose England over staying in Canada to go to university?
To be honest, it was my brother. So my brother actually he was doing his undergrad at Queen's University here in Canada, and he did a 1-year abroad program, his first year in England. And he came back and, he did his undergrad, then he wanted to go to law school. And he said, Fahana, like if I could go back in time, I would have just gone to England, done law, and then come back. So obviously I knew I didn't want to do medicine. It wasn't for me, but I knew I wanted to be in healthcare. And so pharmacy was kind of like an attractive field and something I thought I would enjoy. So then he said, just why don't you apply to England? You can go straight from high school. And that was it kind of just went from there. That was it, really. So my brother and then my dad pushed it as well. So it was more probably peer pressure from my family than anything, but it was great anyways. I love it. I think I would make one point that I feel is important on that fact of like, which one is better? Like, is it better to, go to a different country and like do the degree, qualify and come back? Or is it better to do an undergrad and then go on to a professional degree like pharmacy? And I just want to, like, it's something I actually feel really passionately about. And I don't have a vision or a view, or I don't have a concrete decision of what is better over like what is better. But I definitely think that people need to consider the pros and cons when they're making those decisions, because the one thing to just consider is if you want to move back to the country that you came from, you still have to do all the qualifying there. And that also takes time and that also takes money. So it's not necessarily any quicker per se, because if you did your undergrad here in Canada for a couple of years and then got into pharmacy school, you probably end up finishing around the same time. And another thing to consider is also like, if you're not sure about what you want to do and you're going into a professional degree because, you just want to have a profession, which is completely fair too for some people, just think about it. Like that 4 years or 3 years as an undergrad program might give you, it might change your life. You don't know.
So just very quickly, you already talked about what sector you're working in at the moment. It's quite similar to the sector you were working in before. Now, you didn't touch on too much about what you've done after you finished the STEP program and you finished working in hospital, because I know you personally, so I know that you did move forward from hospital. So what did you, just kind of edging on from that, what did you then do before you left the UK and came to Canada? What were you doing?
Yeah, so in the UK, so once I finished the STEP program, I knew that I kind of wanted to make a little bit more change on a larger scale, more regional scale, as everyone dreams, it's a good thing to be a dreamer sometimes. Like I was like, okay, if I make change on a regional level, I can go national, and who knows, right? So I moved into CCG. It was a very trending like area to move into at that time as well. It was really competitive because everyone wanted to make the move, whether it be because it was a 9 to 5 or it was a desk job or like no on calls, or because they actually had a passion for it. Clinical commissioning groups are basically the payers for that region. So they hold the budget that NHS England gives them that they're responsible for in that area, whether it be in primary care or secondary care. So within the CCG, they'll have different people managing different budgets and different prescribing and formularies and things like that. So it's kind of like the back scene of what is going on. And so I was a practice support pharmacist or practice link support pharmacist. And so I worked with GPs. I think I was at one point working with 13 different GP practices. After that, I moved into, I did that for 3 years, and I was like, okay, I'm ready for a change. I've, done this for 3 years. I want to see what else is out there. So I moved into a position with the CSU, which is the Commissioning Support Unit.
Okay, since moving to Canada, me and you have been speaking, and we've been connected on so many different ways. And some days I'll send you really like frustrating messages, like, "Oh my God, like this is nothing like the UK." And other days you'll say, "Oh, can you believe that this is different?" and blah blah blah. So, what are the clear-cut differences? Like, if you could think of like even just two, like really, really, they don't have to be like annoying or frustrating differences for you, but just like what are the clear-cut like differences between practicing as a pharmacist in the UK versus here?
I think it's the accountability would probably be one of them. So in terms of, as you know, and I don't know how many of your viewers will know, but here you have repeats on prescriptions. So I think, and you have repeat dispensing in the UK as well. It works. I think the function is very similar, but I think the way it works is quite different, and the way it's organized is quite different. But I think the accountability on the pharmacist to kind of be that liaison of what a patient needs when they need it with the GP is maybe a little bit more onerous or complex here. I think that there's a lot more dependence on the pharmacist to communicate with the GP versus in the UK. I remember when I did my PreReg, and I haven't done community pharmacy since like my summer placement. So it's been like 10 years or something, or like just under. But in terms of community there, I remember being very explicit about where our boundaries were to a certain extent, and when we would refer patients to their GP, and they kind of had to like take that ownership of their own medicine, their own healthcare, and then speak to the GP about it. Whereas here, I don't know if it's COVID, because obviously I've only practiced here in a COVID time, it seems. And I don't know if it's COVID or if it's the culture or what, but I think that there's a lot of onus on the pharmacist to be that liaison with their GPs. And I think we try to say like, you need, I think for referral wise, like if it's something that we can't manage in the pharmacy, we have to refer them, because like they need to be reviewed clinically if it's something dangerous or something that can't be managed over the counter. But I think in terms of just managing the logistics of getting their medicines and everything, because of the way that the repeats are managed here, a lot does fall within the pharmacy. Another thing that I find is very different is probably the like education and training. So I think in terms of the levels of support staff that you have within the pharmacy, it's very different. So here you become you're an assistant, but over there you have your healthcare assistants, your counter assistants, and they do various courses. So the pharmacist can be in one area of the pharmacy with like a ACT or a technician or dispensers, but the counter might be on like another, like not directly where the pharmacy is. Like if you've ever seen a Boots pharmacy, you have like the pharmacy dispensary, and then usually actually the healthcare counter is quite far away, and you'll have a healthcare assistant who's been trained and done modules on like, or a pharmacy student who's had to do modules and training on hay fever and cough and cold and all of that, and they're trained to kind of help with assist and then refer anything to a pharmacist after that. Whereas here, it's not really trained in that way. So you do have technicians, and they are ACTs essentially right off the bat.
To say the difference between that and England is, in England you would have a technician, but then you would have technicians are then split into different roles. So you'd have a medicines management technician. They would more likely work in a hospital. You would have an ACT, an accuracy checking technician, because I guess a technician just on their own in England can't accuracy check a prescription. You would have to be an ACT to do that. Whereas here, technicians can do that. Also, just in regards to what you said about the training, yeah, that's definitely something that is, you already know, it's a big pet peeve of mine, because I don't think that anybody should be able to walk into a pharmacy and just automatically be a pharmacy assistant. I think that the training that we have in the UK is definitely something that is beneficial, because it's not just about healthcare in general, it's other things like confidentiality. When you are a health dispensing assistant, or you're working as a healthcare assistant in Lloyd's or your Boots or your Co-op or whatever, they get trained in a similar way to how we would get trained, in the sense that they would have the confidentiality training, they would have the questions to ask when somebody walks into a pharmacy. You know, you don't always have to refer to a pharmacist. You ask them the who, the what, the why, where is the pain, all that kind of stuff. And they don't seem to have that here. I'm going to let you continue, but I did want to just say that we are talking specifically about Ontario. So this may not be the same in another province. It might not be the same in Alberta. It might not be the same in British Columbia. But as for Ontario, these are our comparisons to the UK.
I mean, there's pros and cons. I think there's a competency. Like, I think we have to, I don't know what the education is, right, behind some of these roles. So I think it's very different, the roles. And I think that it's important to note, like, that they may or may not work. And I'm not in a position to say, because I haven't experienced it to such a level that I would feel comfortable saying which one I feel more comfortable with. I just think that, like, both systems can learn from each other. Education and training is a lot more established in the UK for pharmacy support staff. So I do like that.
I think for me, the biggest thing from what you've mentioned is the accountability. And I think under accountability comes a lot of things. Like, it's not just the fact that, I see so many times where a patient hasn't seen their physician for over a year and they're just on this medicine consistently. You have 12, 13, 14 refills. And it does end up being the pharmacist who has to do the chasing and, like, oh, have you seen this patient? Do they still need this drug? Whereas in England, where you do have the RAs and the RDs, so if you're familiar with UK prescribing or dispensing, you will know that with repeat dispensing, you have there's always a limit to how many you can do and how many things you can have and what drugs can be on there. And there's always an RA, which is the repeat authorized prescription. So it's the prescription that is legal. And then you have the RD. So for each dispensing, essentially, you have a new prescription. And I think with here, one of the things with accountability is even how they prescribe, or, what doctors can prescribe on. They can just take a sheet of paper from the back of their notebook and write an address, which could be in my car, and essentially put repeat times 56. Under that accountability umbrella comes the issue of verbal prescribing, which me and you have discussed this many times. That can cause so many errors in itself. The fact that a doctor can pick up the phone and say, hi, I'm calling for Susan. Susan who? Oh, Susan, she's one of your patients? Oh yeah, but I've got 50 Susans on my list. Okay, well, Susan, whose phone number is blah, 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 gives me a phone number, and I'm prescribing her some naproxen. Now, for somebody who, if the phone line is bad, you might not be able to hear properly. I don't know what the logic behind that was in the sense of having verbal prescriptions, but whether it's because of time or stuff like that. But again, this sort of falls under accountability. So yeah, accountability for me is one of the biggest ones. And I think that's something that people should prepare themselves for when they do, I guess, journey down the route of relocation and wanting to practice internationally. Do you think that as a pharmacist coming from the UK, you have any kind of, I don't want to say upper hand, but is there anything that you feel, aside from obviously the things that we've already discussed, is there anything that you feel like the UK has taught you and can benefit your practice as a pharmacist in Canada?
I think I just want to add something on that note, and I think that it's important to realize that we're trained a certain way, right? So in the UK, you're trained a certain way. Now, being in a different environment, like changes, it's good, but it's hard. And I just wasn't used to the practice. And I think that's one thing that, you know, your viewers who are considering moving either from England to here or vice versa, just need to bear in mind that you're trained a certain way, and this is going to shake that training. So this is not going to be, you know, for example, the students who trained here don't find verbal orders that like appalling. They don't find it weird or odd. I remember our dispensing classes, which were like at a weekly or bi-weekly, I can't remember, but like one of the biggest exercises was about looking at the legal aspect of prescriptions, right? So checking that they had ticked all the legal requirements. Here, I think that is still there. Like there's a legal list of things that need to be on a prescription, but I feel like maybe the practice isn't as stringent in terms of like, yeah, okay, you need to know like what you're giving. But I think sometimes pharmacists might feel in their competence that they're okay to go with what's on it rather than have to like confirm.
I would still go through name, date of birth, address, doctor's signature, date on the prescription. All those, I would always tick that. That would be the first thing I look at when I'm looking at a prescription. And if it's a controlled drug, I would look. It has the name of the drug. It has the strength. It has the form. It has
words and figures.
A direction and words and figures. Whereas here, you can write a prescription for morphine or Statex, whatever it is, as directed. Take as directed 56. In the UK, I would look at that prescription and I would say, I'm not dispensing that because it's not legal. Also, you can't just write morphine. You have to write, if it's a Zomorph, you have to write morphine slow release capsules. You know what I mean? You have to have the exact information. Whereas here, a lot of the guessing is left to the pharmacist. I have to sometimes take a prescription to my manager and say, what do you think this says? What do you think the prescribers? So you spend so much time just trying to figure out what they actually mean.
You know, you spend so much of the first year or two just getting your feet on the ground and understanding how everything works. And I think now that we've kind of, you know, done that a little bit, again, you more than I think that we're both at very exciting points in our life where we're going to figure out all the experience that we have under our belt, what that means for us here now in Canada and settling down here as pharmacists.
As much as it can be frustrating, as much as we're saying that it's very different, I think it's still valuable. It's still a valuable thing to do, a valuable process to journey through, because as Fahana says, it teaches you so many different things and skills that you thought you didn't have, that you now kind of are realizing that you have. What would you say to any pharmacist who is in the UK and they're just thinking of doing something different? What would you advise them?
I think that personally, don't do it for the money. I think that the money can sound appealing, but actually you have to remember that like everywhere has different standards of living. And so that even though the salary might sound higher, it doesn't always translate into what you think it might. Ultimately, like, don't do something for the money. I think challenge yourself for sure. I think if it's something that you're sitting, in the UK or wherever, and you're thinking, what if, and if it's a recurring thought in your mind, the only way you're going to know is if you do it. I think don't ever fear coming here and it not working out. Don't come with that thought. If it doesn't work out, it doesn't work out. But that question that you're sitting hours in your room thinking about in the UK are never going to be answered unless you actually try it. And if it doesn't work out, then it doesn't work out. And you did it, though. You still ticked a box. You still got experience. You still achieved something. I think the last thing that I struggle with that I would probably give to anyone who decides to move, and my dad has to remind me of this all the time. I often say, oh, but in the UK this, but in England this, and it's across the board in my life, not just pharmacy. When you're here, you can compare to where you came from for learning, for reflection, but don't compare because you're out of frustration.
Thank you so much. I really appreciate your time and appreciate your contribution. And I really, 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 really hope that, obviously as the years go on, we're able to learn more and grow and improve and all those things. But yeah, thank you guys so much for watching. I really appreciate it. If you want to see more, comment, share, like, everything, do all the stuff that needs to be done for this video to kind of be shared and for other people to hear about it. But yeah, thank you so much and see you in the next video.